My name is Russ Evans, and I'm the Chief Operating Officer with Probari. And what we do is we offer a proven clinical model to help nursing homes with clinical care. We came from a grant, a Medicare, Medicaid grant called Optimistic. And the impetus behind this grant was to put nurses into nursing homes so that they could ultimately enhance clinical services that were in there. And the goal that they were trying to achieve was to reduce avoidable transfers to the hospital. They did this for a number of ways. They would do direct clinical care with residents. They would also do advanced care planning. And so palliative care was brought in. And then also they would look at quality improvement. So they would do reviews and do quality audits to ensure that the systems that were in place at the facilities were optimized as best as possible so they could take care of residents. And the idea behind this whole thing was that if we added resources into a facility that were outside of the normal scope, so a different kind of role into the nursing home, they could focus on things that were not being done routinely by the facility, and they could achieve some of the metrics that they're attempting to achieve on a regular basis. And we were glad to see that this demonstration project was successful. In terms of hospitalizations, we were able to see a reduction of about 33%. So this was less people going to the hospital that didn't need to than were before. And of course, that translates into savings. So you would see that Medicare spending went down overall, about 25%, which translated into a Medicare savings net at the end of this entire project of $17 million. This actually went for 8 years in total. And so as most grants do, there is a transition plan. So after the grant's over, what do we do next? And so that's where Probari came in. So with my co-founder, Dr. Kathleen Unroe, who's a geriatrician, we started Probari to take the model that we had developed in Optimistic and put it outside of the demonstration program so it could go beyond just the borders of what the original demonstration grant held us to. What we've over time done is moved it from an in-person model to be something more scalable and generalizable that would actually be a virtual offering. So Probari adds value to nursing homes by taking some of the complex tasks that they're required to do on a regular basis that are essential for the quality outcomes that we see, but allows the staff to focus on resident care. And that's really the whole point. So instead of nurses that are in the building doing computer work or reviews or audits, my team can take that off of their hands and they can review these things for them, feed them to them in very easy and manageable ways so that they can spend their time at the bedside, which is where we want them. And the goal is that we're actually increasing the capacity of the overall staff and creating more capacity in general for the care of the residents that they have in the building. You would say that the core program that's offered by Probari would be our admissions program. And really, this is something that we offer all of our partners. There are others that we can do, but this really recognizes the most important contribution that we can make to the nursing home environment. So when residents are in hospitals and they transition into the nursing home, we know, as well as many of the organizations that were here today, this is really a critical time where errors are made. And it's not always the fault of the nursing home or the hospital, but there's just a lot of things that are going on. So there's data systems, EMRs, discharge instructions that all can contain errors or be missing information. And this really sets the nursing home up for failure. So when they get this resident, they don't have everything that they need. They may not understand what happened at the hospital. And then generally speaking, because it's a chaotic environment, there's a lot going on, they could miss things. And so what Probari does is sit in between the hospital system and the nursing home. Our team has access to records at both. So we have direct access to the hospital, and we also have direct access to the medical records in the facility. And the whole purpose of this is to reconcile what we see going on in both places and make sure that we have the most accurate and up-to-date information. The trick to this, and really what makes it work, is that the software system that we use aggregates all of our recommendations that we make based on any errors or gaps that we see, and it funnels it down into a checklist that can be handled by the director of nursing or any management staff in about 15 minutes. Most of our partners will take that list into morning meeting. They'll review it with the different leaders in the facility. And then in about 15 minutes or so, they've addressed all the problems that we've seen in the previous day. This is usually 1 or 2 pages. It's not very long, but it's very specific and it's very tailored. These aren't going to be generic recommendations that you're seeing. These would be very specific to medication issues, notes that we saw in the hospital that need to be brought to the attention of the facility staff, or just general practice errors that we find that needed to be up to date. We find that through this program, we're still having an impact. So having a person that goes into a building, of course, would be the gold standard where they can take off actual responsibilities from the facility staff. But this model, it's virtual, has, still a very strong 20% reduction in hospitalizations that we're seeing. So if you'd like more information about Probari and the things that we're working on, please reach out to us. Our email is info@probarisystems.com, and we'd be more than happy to explain our system and even give you a demo of what we do. Thank you.